And that was my moment to say a moment of gratitude and just express, I'm glad to be alive. I'm happy for the people that are caring for me, happy for my family. Look, I've got a great industry behind me.
Hey everybody, Brian Hoagley here with CISO Life. Welcome back. Very excited again today to have an amazing guest with us today, Chris Tillett. Chris is with Exabeam, where he's a security engineer representing the New York City area. Chris is joining us from his chalet in Connecticut, I believe, right now, or your second home. Also joining me today is my partner in crime, Taylor Lehman of Tufts, now Athena fame. We want to welcome both of you to the show and talk about some really interesting stuff.
I'm excited to be here with you guys today. As Brian mentioned, I'm one of the partners in SideChannel and also the CISO at Athena Health, which is an organization that works closely with healthcare. I've been in healthcare for a long time. Hearing about Chris's story was, kind of inspired me a bit to reach out and kind of hear what his experience was. Chris, as you know, I don't want to disclose your PHI because that's like bad security in healthcare, but fairly public, post RSA. You're a survivor of COVID, which is awesome. It was huge news in the cyber industry. I can speak for my group and the folks I socialize with. A lot of people, when they heard about the positive diagnosis and then subsequent hospitalization, it was something that was on a lot of people's minds, people who didn't know you, people who just met you. Aside from just being thankful that you're here with us now, can you share a little bit about what your experience was like coming out of RSA?
Yeah, thank you both for having me on and for wanting to focus on a positive message. I think that's very important for everyone today. But I have to tell you, when I left RSA and I just started feeling like just beaten down, just very worn down, and not because you were asking me questions, but it was more just, I just had no strength left. And I remember not, cutting my booth duty short. And then when I flew back home, I just felt like a truck hit me. And then essentially by Monday, I had 102-degree fever. And I remember hearing from my wife, who's a nurse, and she said, you don't have COVID, you just have a man cold. And and I said, it's possible. I said, but I'm going to go get tested. And essentially they didn't even have test kits in Connecticut anywhere. It took a while to get that. So by Friday, she was using that little pulse ox on me, measuring my oxygen levels and my heart rate. And when I was lying down, I could barely even take my medicine that they had given me. They kept thinking it was the flu. And then when she had me stand up, the levels went down from 91 down to 77. And so she's like, okay, we're going to the ER. And once I went to the ER, the doctors there, Danbury Hospital, amazing work. They recognized it immediately. They put me in a negative pressure room so I wouldn't infect anybody else. And the ER doctor there, Dr. Side, said, I believe you have COVID. I said, I've been saying that all week, doc, and I would love for you to say that again in front of my wife because she told me I had a man cold. And so no matter what, I was always trying to find a way to laugh at something, even though I could barely breathe. And then from there, I descended into chaos, went into the coma. They had to basically put me down and then put me on the ventilator. And it really wasn't until day 7 that I started to kind of come out of it and improve. But I can say that I didn't really feel like 50% of myself until about 5 days after I woke up. I had a I was hallucinating. I was having fever dreams. And so I didn't know any of this was going on. I still felt like I was in the ER. That's how fast it felt for me. I had an insane 10-day dream sequence that created a whole alternate reality, which could be a part of if I describe that, that's another whole podcast in general because it was that nuts. And then, I finally get to a regular, stable hospital floor. And this nurse comes and goes, you're famous. And I said, for what? And then she showed me the GoFundMe and then, on my phone. And I started reading all the comments from everybody in cyber supporting my family, knowing that I could, it's possible with, 6-month-old boys, I may not be there for them. And I just remember I was up till 4 o'clock in the morning in the hospital bed, just in tears of just feeling so humbled and grateful to be to get the care that I got, but also to be a part of this community and people that supported my family and knew that I knew that they had my back. And my company, Exabeam, not to plug them too much because I know I can't speak for them too much, but they did a wonderful job of supporting my family too. And so, to sit there in the hospital and you're quite lonely, you don't see nurses but for about 15 minutes, a couple of hours a day, and that's to protect them and to protect the PPE. It made you feel really good, and it made me realize, okay, I did make the right decision 25 years ago, accepting that PIX firewall and saying, yeah, I'll install that, and then taking the Sunbox and okay, I'll install Checkpoint. I don't even know what the heck this thing does, and then that was my career into cyber from operations. So thank you for all of your support, and for everyone else who did support my family. I am truly grateful.
Yeah. Oh, well, I think it goes without saying we're still trying to figure out how to make PIX firewalls work. So we're glad you're here. But Chris, your wife's a nurse, right?
Yes.
What kind of nurse is she?
Well, she started off in cardiac, and then now she's doing private home care. Okay. So she helps very specific cases. I can't say too much more because of the PHI. No. But she does a lot with several communities around here.
Great. So she was like, literally the first person to see you, had probably no training on what COVID looked like at that point. I feel like nobody did.
Yeah.
How is she doing? Obviously, I know that we heard a lot about your kids, and obviously she having to like many of us who've got kids at home, having to stay and watch them, not being able to work. But this was a big, she is a big part of this story too, right? I mean, just what she went through, and obviously being there for you, I think is amazing to have that, a caregiver in the home or close by. But definitely, just kind of thinking of the impact of being in the profession while this is all going on, and now having her husband also be affected must be, kind of a crazy feeling. I mean, I don't know if you can share any of what that was like, but we're definitely, there's always this side of the story that gets missed, and how is she doing?
She's doing really well. To manage all that she did at the time, the boys would take a 30-minute nap and then be up for 2 hours.
Yeah.
And so, here she is having to manage my healthcare, my decisions, because I had signed over a healthcare proxy to her. So doctors would have to call her and go over the different treatments, because a lot of these treatments were treatments that the CDC and the FDA had to approve for my care, and they didn't know if it was going to work or not, and we still don't know if it worked or not. But they had to, explain her the risks and the rewards and what it could do while managing two twins and being in quarantine herself. That night when the doctors and ER said, hey, we think you've got COVID, and they gave me the test, they sent her home. And so she had to manage all of this by herself, manage, dealing with my HR department, manage, talking with my bosses, all of our family members. It was an intense amount of stress for her. Okay. And so seeing the support did help her. And using, some of those outreach, being able to reach out to people over those programs did provide her some level of solace to deal with this. But, if I were to describe all the details that she went through in that 2-week period, it was insane. She started feeling bad herself. So she had to contact my sister and go over the will to make sure she understood it, and contact my best friend who's the executor, because she's like, I don't know if now I'm going to go down, and now I've got to look at how the boys are going to get cared for. Yeah. So really the best way I can describe her is Wonder Woman. I mean, she did everything. I hope you don't have any copyright issues with me saying that, but but
say it
really,
again, man. Say it again.
It's Wonder Woman. That's the truth. And I was really proud of her. I was so proud of everything that she did, and handling all the different types of media, trying to extract data from her. The governor has to announce that I was the first COVID patient, and he didn't say my name, but he had to say who where I lived and all that. And so she had to strategically leak out information into the local community, because they said, 45-year-old man oh, I'm 45. I've got a 12-year-old. Is this, are his kids in the school? So she had to, think of how to leak out information so as not to cause panic. There was just so much on her. And what I really appreciated was the fact that she cared about everybody else first. My care, even the town people, of making sure that she didn't cause panic here, releasing information, caring for the boys, caring for my family, making sure that she gave them information so that they were, kept up to date. It was a lot. And so, I really, that the month and a half after that I took to completely recover and make sure that all that, medication that they gave me to keep me down was gone. I just tried to do as much as I can to show her how appreciative I was of her support. And, and she's very appreciative of everybody that supported her in that time.
Yeah. She sounds like, as much, if not more, in that hero category as the docs at Danbury, for sure.
Yeah.
That's awesome.
Yeah, those doctors were amazing. Matter of fact, my infectious disease doctor called me 2 weeks ago just to check on me, just to make sure I was okay, discuss new protocols that they're doing. So, I mean, they really have been just professional all the way through and through.
That's awesome. Can you tell us, like, I know that, hearing a lot of stories and what people's experiences are like inpatient, like of what you can recall, like what was the inpatient experience like, being in the hospital? I believe you said you were in a coma, so you weren't with it the entire time, but the time you were, what was that experience like?
I would say it was an extremely good one, as much as scared as I was. Because I've never been sick really. The last time I had the flu or anything like that was the swine flu over 10 years ago. And so, I don't get sick often. I don't go to the doctors that much. So to all of a sudden to be hooked up to all these different machines, and then your family's not able to visit you, your friends aren't able to visit you. So your only interaction is a few moments with a nurse or a doctor. But what I appreciated about them is, while all the chaos was going on in the hospital, I never saw them stressed, flustered. I thought I was the only, COVID patient. I came to find out by the 7th day I was in there, they had hundreds of,
Wow.
several patients. And then Army Corps of Engineers was actually building out a temporary hospital in the parking lot because there were so many COVID patients from Fairfield County.
I've never been in a hospital like you, Taylor, or yourself, and have to come out of something, but I would imagine you've got kind of this, I don't know, refreshing new view on life, right? Like you it's not the why me, it's great, I did it, now I can do something. Has that changed your view on like what you want to do or where you want to focus, or anything like that?
It has. It actually has. So, tomorrow I start a new weightlifting program. So, I lost some pounds doing it. I put on the COVID-15. I lost 25 pounds. I put on my appropriate COVID-15, and I'm not going to lose it. I'm not going to gain any more. But yeah, there's new skills that I want to learn. There's a lot of volunteer work that my family and I were already into, and we're going to now add more to that.
Nice.
I've had the privilege now to have individual families reach out to us and help them with their COVID experience. And unfortunately, for a couple of cases, they passed away. But in other cases, we've been able to help them, just providing comfort, just saying, hey, look, okay, you got the pulse ox. All right, here's the numbers you need to write down every couple hours, and just record that. And if it goes to this level, you need to, contact, because a lot of people were having an issue like, hey, my dad's 65, he got caught with COVID, and we think he should be in a hospital. And the hospital sent us away saying he's fine, but if he gets further into chaos, let us know. So my wife and I have been able to help them go, okay, here's the levels that he needs to be at before you contact the hospital again. Otherwise, he just needs to rest.
Right.
And so that, just hearing that to somebody who didn't know that, gave them a lot of comfort.
Yeah, absolutely.
And then being able to use the resources that were given to us to help other families. And so we were able to do that with a large chunk, able to help a family member who's got a problem with their health. So they would be in a very precarious position if they got COVID. So being able to just focus again, not focus inward, because when we focus inward, we get selfish We don't think of, we start thinking, why me, but focusing outward. How can I help other people?
Yeah, so Chris, let me ask you, this is like a cliche question, but like, what do you think, like, imagine you've got an audience of 1,000 people in front of you right now, like what, like, who are all looking for something to do to try to help. Like, they obviously can't talk about it from your perspective, but like, everybody who works in healthcare right now is on the front line of this. Everybody who is at home, probably wondering, there's got to be something more than I can do than WebEx and telehealth, or not telehealth, like Microsoft Teams or Slack or whatever medium you're on. There's got to be something more people can do. We've been trying to figure this out in cyber for weeks, but just interested in your perspective now. Like, you've got a clear understanding of the problem and the answer.
Yeah, well, I definitely would say that the stay home, I mean, when I look at the amount of work, when I just watched the amount of PPE they had to churn through just to visit my room one time, just one time, and having to watch them take it all off, toss it in a trash can. They walk out, they were walking out the door like this. Somebody else opened the door for them, carried the little crash cart with them, and then they had to put all that back on. And so when they're telling us, hey, look, maintain social distancing, don't go out unless you have to. If you think about it from a nurse's perspective, that's got to wear a mask all day long, squeezed into her face, and with either goggles or a face shield, and they're uncomfortable and they're sweating, and to just think, well, if I get COVID and I have to go in the hospital, then I'll just deal with it then. That's a very selfish attitude to have, right? You're not putting the other person first. So I think if we live by the principle of what is good for my fellow man, if we think in that way, then that's going to spur the appropriate actions, whether either to think about the fact that, could we be exposing someone else's family to this? Maybe I feel fine, but maybe I don't know that I'm a carrier for this disease. So following those guidelines, I know that sounds so basic, but when I look at it, it's a simple thing that we can do.
On that line, like, Brian and I have done a bit of trying to get iPads for people so they don't have to break PPE while they're inpatient. So in that example, you can talk to the nurse without her coming into the room, sort of thing. So there's stuff like that that's out there that I feel like if people just knew about, they would go after. But tech is playing a big role. I'd just be interested, like, where do you think tech could fill the gap? Like, if a lot of tech people are probably going to listen to this. Where would you say, if you're a tech company and you do X thing, make iPads or make equipment that would either make the patient stay easier, make the family staying in touch with your family, or alleviating some of their anxiety would be somewhere in there. And then obviously, like, who would have thought an iPad would actually reduce the need for PPE turnover, but in fact it does. Like, stuff like that. Any thoughts from being on the inside?
Yeah, I would say, being able to FaceTime my family was critically important. So even making sure that the guest Wi-Fi in the hospitals was robust enough for all of us to FaceTime at the same time, that was critically important to me, because and so you think about the nurses and doctors, how can you reduce what they're doing? How many times they have to come into your room and interact with you and reduce their exposure. So being able to, if the organization has Teams or Zoom, being able to do that. If there's, what I would love to see is that cart that they bring around. And at least in Danbury, they had the cart, it had the pull socks, it had the BP cuff. Take one time to show me to do that. And then that's part of my little project to get going. As long as my levels are okay and I can do it, have me put the cuff on. I'm a fat, bigger guy. So it went right on my forearm. I knew how to do the pull socks. And then I could press the buttons and she could, he or she could walk me right through it. And that reduces, like you said, the PPE churn and the exposure.
I've never seen more generosity out there from current vendors who, are trying to do the right thing with their customers who might be under licensed or not have what they need. And I'm seeing a lot of just like super awesome people just supporting one another in that sense. I can't say the same for folks who are looking to take advantage of the situation, but I would say by far and large, I've seen nothing but awesome things from like Microsoft and Google and Order and some of these other companies that focus in specifically in healthcare. That's been really encouraging. I'm not sure what I'd say about market changes and dynamics, but I do hope that people do take seriously that safety is unfortunately not in the CIA triad, but needs to be, and that we start thinking about the safety of systems, because they are very closely linked to the safety of people, especially when you talk about cybersecurity in a hospital. Having been very familiar with that topic over the years. The one thing I do want to just also point out, and this is not my podcast, but I do want to say the thing that is sorely lacking still is the need to have the right amount of empathy going into commercial conversations right now. Everyone is affected in some way, shape, or form. To pretend that you're not, to pretend that all you got to do is sell something, or get the thing turned down or whatever. That may be one of the goals, but the first goal, I think, and it will help us all, is just understand the people who are sitting across the table, what their needs and concerns are, maybe in work as well as outside of work, and be sensitive to that as you approach any kind of work you're doing now or in the future. And I think if more people just did that, all of this would get easier, frankly.
100% agree.
Just being thoughtful, which is a sad, weird thing to say, but I'm a dad, so I have to shout it multiple times a day at my children. But it's just as effective advice as it is right now. And I think nobody really always understands what other people are going through. Nobody's ever walked in each other's shoes, but I think this conversation has really helped us understand your perspective, Chris, which I think is great. And certainly some things to give us some things to think about and be thankful for.
Hey, I want to thank Chris and Taylor for being on today. Chris, again, thank you so much for sharing your story. Great insights to everything you went through. From both of us and everyone else I think you've talked to, and anyone else we could possibly represent, in saying thank you for this. And we're all really, really happy that you are okay. Good things all around there. Very, very good to hear. Again, I want to thank everybody for watching. This is Brian Hogley with CISO Life. Thanks again.
Thank you.